So I'm here in the waiting room at the hospital waiting to get an x-ray of my hip. It's called an EOS. So they're going to take a picture of me standing and a picture of me sitting so that the doctor kind of has an understanding on what types of information that he's going to have to do for the hip replacement. So this will probably be the last x-ray that I ever have with my existing hip. So with my hair being the way that it is and not being able to comb it after surgery, I really just wanted to get like a nice short cut or just shave it all off. But I want it to be fun. And I just want to rock it. I want to rock, you know, color, cut, and just make myself feel good about the hair that I have, even though that I'm not going to be able to comb it the way that it needs to be. So I just got done taking my first pre-surgery shower. They gave me this special soap that I need to use when I take a shower, and I have to use it once a day for 5 days prior to getting surgery, and then the morning of the surgery date. It was kind of difficult because I can't reach in places that I normally would, even without special equipment. I mean, they want me to use a washcloth, a new washcloth every day, that I use this soap. So using my special loofah, stick is not really an option. So it was kind of difficult doing it on my own. I got the majority of my body clean. I feel like I did the best that I could. But yeah, there were just some spots where I could not reach, and you know, it is what it is at this point. Now I'm about to use this cream that they want me to put in my nostrils, so I have to do that once a day. This is another thing that I really feel like I'm gonna struggle with. We're gonna see how this goes, but basically I need to put a pea-size amount on a Q-tip and then swab it on the inside of my nose. Alright, well, here, I'm gonna show you. I failed. So now I have cream on my dresser and I have to start over. So I've got it sandwiched in between my shoulder and my knee, and I think I used too much. This is so weird. I have to clean the sheets, and I have to change my pillowcase every night, and I have to make sure that I'm wearing new pajamas every single night before surgery, after taking my shower before I go to bed. It's a lot to remember, and I'm totally over it. Today is the last day before my surgery, and I'm having toast for breakfast. It wouldn't have been my first choice, but since I can't have anything before 7 a.m. and I need to have my IV put in later today, and it is so early, this is what I could come up with. So the things that I need to do today to prepare for surgery is I need to take my 2 pills, I need to take my eat my breakfast, drink lots of fluids, make sure I don't eat anything after 7 a.m. because I have my procedure for the IV. I need to take my nose ring out. Yeah, I have to take my nose ring out, and I have to take my belly button ring out. And the reason why is because during surgery they're going to be cauterizing stuff, and they don't want any metal on you. So I'm gonna have to take those out. I'm going to shower this morning with the special soap that they gave me, and I feel like I'm not using enough of it. They told me to use half a bottle, but like I'm squeezing and squeezing and squeezing it out, and there's just so much. It's like actually saturating the washcloth. So I've got some left over, so I'll be washing myself with that this morning before I head into the hospital, and then I'll take another shower tonight, and then I'll have to take one tomorrow morning before I go in for surgery again. So I'll be super clean. No bacteria on me.
I don't want to say anything.
You're saying something right now. Go ahead, say something.
Hi.
You need to tell your fans what you're doing.
I'm having surgery.
Yeah, on what?
On my hip. I'm having a hip replacement.
Yep.
And they got tubes all in me.
Yep.
Stuff.
And then stuff.
And stuff. What?
One of these green curl caps they put on the lines. It's got alcohol in it to keep it from getting infected.
What else?
Tell your fans how you feel about them.
I like you.
Tell them what you did to your hair.
Hi guys, it's Tisha. I just got done with my surgery and it went really well. You know, I guess I was asleep the majority of the time, but now they've got me tied to a bed with a pillow in between my legs and straps so I can't move. My restrictions are that I cannot bend my leg past 90 degrees. I cannot crisscross my legs, and I can't, what was the third one? Here's the third one. Bend, cross. Oh, and I can't rotate inwards. My leg, I can't rotate it inwards. So, as you all know, I use my right foot for everything, and I can't do anything right now. They don't want me weight bearing on my right leg at all because they want it to heal. They want it to heal up. So anytime I need to get up or go to the bathroom, someone's going to have to like lift me and carry me, and like so that I can stand on my one foot. I can't use a walker, I can't use a cane like normal, so this is like a very interesting and like special case that the doctors are really trying to work towards finding placement for me. Originally we were talking about going to a rehab center, and that's still kind of like up in the air, but from what I heard, the rehab center won't take me if I can't do rehab, and because of my restrictions and because of what my doctor wants me to do, or rather not do, I can't do the exercises and occupational therapy that they provide. So, I mean, a lot of things are just really up in the air right now, and worst case scenario, I have to stay in the hospital for 6 weeks until I'm able to stand on that leg. It doesn't hurt as much as I thought it was going to. I feel like I've got a high tolerance of pain. Like right now, it's not like surgical pain. It's nothing compared to what I had, you know, yesterday. Just being able to move my leg at all was extremely painful because it was bone grinding on bone. So now the discomfort or pain that I'm feeling is numbing. My leg feels numb and it feels tingly. Like if you were to have slept on your arm or slept on your, you know, one of your legs for a long period of time, you wake up and it's got the pins and needles type of feel. That's what I'm feeling right now, which is like, again, like 10 times better than what I was feeling before, just yesterday. Which is, you know, it's tolerable. So when they ask me what's your pain level, you know, it's a 2 or 3 versus a 7, you know, or an 8. Does this dress make me look fat? Hey everyone, it's Tisha. I'm still in the hospital, and they've got me attached to this device, I guess you would say, that is keeping me still. So it wraps around my waist, It goes down the length of my leg and then again wraps around the rest of my right leg. And what this is supposed to do is it's supposed to keep me from bending past 90 degrees. It keeps me from rotating my leg. And then this thing that they have, this pump, keeps circulation in my leg because I'm going to be here for a while and I'm laying in bed. They want to make sure that I don't get any blood clots or, you know, I guess get stiff or anything. So to keep the circulation going in my body, they decided that they wanted to put a wound vac on. So it's kind of like a big giant band-aid with a vacuum cleaner attached to it that kind of just sucks out all the gunk that does not need to be there, which makes for easier, better healing. And so now I've got like all these devices and tubes and stuff hanging off of me. The doctors were going to send me to some type of nursing home. We did some research on that and decided that that was not a good idea for me. I mean, come on, let's think about this for a minute. I've got 2 legs. One of them is pretty messed up right now. And if I get an infection or something happens and they need to amputate my right leg, which is the one that I use all the time, yeah, I would be a monopod. I would be Tisha unarmed and unlegged. So I'm gonna be here for 6 weeks, which is, yeah, I mean, the facilities are really nice and the nurses are super nice, and you know, it's not home, obviously, but I feel like I'm getting the best possible care that I can here. And you know, I'm in the hospital, so if anything does happen, it can get taken care of immediately. But yeah, it's gonna be a long 5 weeks. I'm counting the days down until I can go home, but until then I'm gonna continue showing you guys my experiences here in the hospital, and I hope you're still here for the ride. Hey guys, it's Tisha. I wanted to do an update on how I've been doing. It's been a week since I've had my surgery. I have completely ditched the hospital gown and now I am wearing some silky pajamas, which feels much more comfortable, and I don't have to worry about that open back situation. I've had my dressing taken off, the staples have been taken out, and now I am a little bit freer to do some things. I still have to wear the brace, which is a 6-week adventure that I'm gonna have to go through. I am going to be here for at least till the end of July. Within those 6 weeks, I'm not allowed to walk. I have to stay in bed and keep my brace on and make sure that, you know, I keep my hip precautions, which I can't cross my legs, I can't bend past 90 degrees, and I can't interior rotate my surgical leg. So it's going to be a challenge. I've been trying to use my left leg to do a lot of things. So like texting, I'll use my left foot, and just trying to stay still and not being too active so that my leg can heal up. Yeah, so nothing much to update on, except they did take out my central line. That is healing really well. It felt a little uncomfortable after they took it out, but nothing to worry about. And so yeah, for the next 6 weeks, I'm going to be here in the hospital just healing up. So stay tuned for more updates, and I will keep you informed on what's going on and how my stay at the hospital has been going. See you later!